So my name is Dr. Tisha Smith. I am the Director of Inmate Drug and Alcohol Programs for the Monroe County Sheriff's Office.
And what is medical assisted treatment at Monroe County Jail?
So we have a MAT program, medication assisted treatment, and in the field, MAT is kind of becoming an outdated term. They're considered to be MOODs, M-O-U-D, meaning medication for opiate use disorder. All of our medications try and help mitigate some of the cravings that people have for their drugs of choice, and the drugs of choice that we medicate for are opiates and alcohol. And so we offer Vivitrol, which is an injection, and buprenorphine, which is a synthetic opiate, which helps, like I said, to mitigate some of those urges that people may feel for their drugs of choice. And then we also offer methadone for those folks that are coming in already on methadone. There is no typical day. I'm kind of all over the place. So whether it's meeting with some of the inmates who want to be in our program, meeting people that are in the program, I also facilitate groups. I do our clinical supervision kind of on the fly as things happen. Our counselors are all over trying to facilitate groups, meet with prospective clients, meet with their existing clients. We're kind of spread out all over. I also run other programs. So I'm responsible for visiting those programs and making sure that they're running. So I work with the public as well to try and garner support for our programs and get people into the jail to offer assistance to our folks. So I think I have a schedule, but when I get here, it just it doesn't exist. So I think after 2 years, I've kind of learned not to really plan too much. So our Maloney STAR program is a new way to kind of envision reentry. STAR meaning S, Strategic Training Advancing Reentry. Our program is specifically geared toward those folks that are going to be coming back out. It's for those folks that are also sentenced to about 6 months or longer. It's a rather lengthy program, but it's split into different components. So the first component really focuses on more of the internal stuff. So we start working on mental health issues, trauma, family issues, drug and alcohol, obviously, and some of the educational components that are kind of missing. So we help people identify their triggers. We help people identify resources in the community that will help them once they leave. And then the second component of the program is specifically vocational. So it's heavily focused on helping folks learn those vocational skills, learn about vocational resources in the community, and hopefully obtain a job. And then the third phase will be heavily focused on that discharge planning. But all throughout this process, we're working with not just the individual, but their families as well. I think with the election of Sheriff Baxter, we were kind of forced to look at things a little bit differently and allowed to pursue different avenues. So with our Maloney STAR Academy, it was really, he gave us the freedom to kind of think outside of the box and present him with different options for what the program would look like, and he was able to select out of what we had provided him with what he wanted to see. But really, with the election of Sheriff Baxter, we were just able to kind of really have some more freedom to really be creative and serve populations that we've never served before. And we're actually in a facility that was really never really served before. Coming from the correctional facility and another location, our program moved downtown. And so now with our drug and alcohol program in the downtown facility, we have access to far more individuals than we ever did when we were in Henrietta. Yeah, we're moving in the right direction. We're increasing our staff. Like I said, we're able to reach a population that had never been served before. Our sentenced and unsentenced women that were here never had a counselor before, now they do. They never had groups, now they do. We have, there's just a lot more boots on the ground, if you will, in this facility where there never had been before. So we're able to provide that case management, individual and group therapy where back in the day they would have just served their time and gone back out into the community. So with Deputy Favada, when he came on board and with the development of the Heroin Task Force, Deputy Favada has gone out into the community and fostered some really good relationships with people that are in our addiction field. And he has garnered the respect of many people in our community. And we work kind of closely in that I'm notified when there's an overdose victim that ends up in jail. I'm notified from the health department, and it might have been somebody that Deputy Favada had come in contact with in the community. So we kind of keep in touch and keep tabs on each other as far as like how we're interacting with those people that are coming in after an overdose. Again, there's really no average, but we have I don't know, anywhere from 30 to 80 people, at least I make some kind of contact with on a weekly basis, be it either in the hallway, they'll stop at my office door, or I'll go see them. We have people that are interested in coming into our program, so they write me and say, hey, I'm interested in medication-assisted treatment, and between my team and I, we kind of just fan out and go see everybody that we can during the week. So I don't know, probably 80. That's conservative, I would say. I mean, the building's full, so we have like 700 some odd people in this building, so I'm probably seeing a lot of them during the course of the week. I don't really keep tabs of how many.
What are some ways in which someone can overcome their addiction?
I think, a lot of people have this, you're always going to have this issue. And I think a lot of families kind of wish they could like turn off that switch and, go back to their regular self. I think it's a constant battle for folks, and I just tell people to get those supports around them, especially when you're leaving jail. A lot of people say that they're nervous when they leave jail, and I appreciate the fact that they're nervous. I want them to be nervous, because when you're nervous, you're on point. And so I just tell people to get themselves a support system to kind of block themselves from themselves, because if you know you and you know your weaknesses, if you introduce other people into that, they can help you save yourself from you. So I would just encourage people to get some support systems and to leave a lot of the negativity behind. There are going to be some negative people in their lives, be it people who want to see them sober, enablers who don't want to see them sober, friends who are jealous because they got sober. All of those kinds of people, I would say you got to kind of leave to the side and develop new social groups and just focus on your recovery. And I also think reaching out and asking for help is important. For a lot of people, asking for help is something that's pretty difficult for them. And so I just encourage people to just talk and get the help that they need. I don't know. I think, there's all kinds of different solutions. So people say that we can legislate our way out of it. We can't legislate our way out of it. We can't arrest our way out of it. We can offer treatment. We can provide supports. We can make it a little bit easier for people to kind of overcome some of the hurdles that they have to overcome once they get out of jail and they're dealing with addiction. Like, people need to hire people. We need housing in our community. A lot of the places that offer housing in our community don't really accept our folks directly out of jail. So I think if we can loosen some of those restrictions and make it a little bit easier for people to kind of come out of jail and enter recovery in a healthy way and in a fair way. I think there are a lot of things in our community that kind of provide roadblocks, if you will, for folks to come out and lead healthier lifestyles. But I don't know if politically we can do much other than what we've been doing, but it's an ongoing problem and will continue to be an ongoing problem, because people always want to look for something to kind of get outside themselves, and so there's always going to be a drug issue.
Do you see this trend of opioid slowing down anytime soon, police presence?
No. I think, in criminal justice, we have this term called displacement. And so that means if you have a law enforcement agency and they target specific neighborhoods, if you focus your attention on one specific neighborhood, the drug dealers and the drama that's related with the drugs moves to another area. So there's displacement. And I think if we specifically target heroin, I think our community will find something else. And they're already a billion steps ahead of us, but we're coming. But I think we're there's always going to be something else. So if it's not heroin, then it's going to be something else. People will find a way to, again, get outside themselves and get that feeling that they're looking for. And so they'll create something else. Yeah, and I know that sounds pessimistic, but it's the reality. I mean, you keep seeing people come in, you get reports of overdoses, you see, I just got a text message this morning about someone that I knew that had passed, that was, incarcerated, and she died of an overdose. And on the way over here, heard about another one, and also knew that person and that person's family member. And so I think it sounds pessimistic, but it's the way it is, and so we just have to keep up with it.
Yeah, Jim Wesley called me the other day. He was saying that there was a slew of overdoses this past weekend.
Right. And I found out this morning I knew one of them. So I think, and even when you're online on Facebook, you kind of scroll up, and then someone says, "Oh, so and so died." The other day I found a former patient in the obituaries. I was looking for somebody else and found him, and so it's just being in this field, that's kind of what you see a lot of. I mean, we've got mental health issues, we've got untreated trauma issues, we have people that, people always associate it with poverty or lack of opportunity, and there's lots of things that contribute to it, but I also think we have people that come from money and that come from good areas, and that, so there's something else going on. But I was just talking about this last week, I think there is a component of our society that would rather attribute it, this drug use and this epidemic, to mental health issues, because it's easier to swallow that your loved one has a mental health issue than it is to admit that they have a heroin addiction or a cocaine addiction. So I think as a society we need to get behind that as well and work on that, because I think a lot of the things that are going on in our society are really just systemic, and we kind of just follow along with the trend, and we call it something else, and we don't call it what it is, which is opioid addiction or alcohol addiction or cocaine addiction. We don't talk about what that is. We just talk about the fallout from it. So yes, people are dying, but it's destroying families. It's destroying people's health. It's causing backlogs in our emergency rooms, and there's more to it than just that.
What would you say to someone who's currently in active addiction again?
Call me, call somebody, talk to somebody. Reach out to someone. I really think a lot of our addiction problems that we see in our society are really a result of lack of self-worth and low self-esteem, not feeling worthy of achieving recovery. I think that I don't think people feel that they can do it. There's fear. There's all sorts of things that prevent people from wanting recovery and doing what they need to do for recovery, but I really think it has to do with people feeling not worthy of recovery, or the blessings and the things that come along with recovery. So I think it's really about talking about it and really being committed. And I don't know if I can push somebody into recovery, because they gotta want it. But my role here in this job is to try and help people see that there's life on the other side, and that recovery is possible, and that they are worthy of leading a better life and obtaining all the blessings and all of the good things that come along with recovery. So that's kind of what I hope. Oh, someone that's grieving. I don't even know what to say. I think that I would tell them that they did their best, and that there's help, and they need to call somebody to get that help. There are plenty of support groups around for people that have lost loved ones. I know quite a few people that are engaged in those organizations. I would also tell them, they didn't do anything wrong, because I know that there's probably some guilt and shame behind that. I don't know, that gets me emotional, because I think of all the people that we've lost, and behind every individual is a family and a friend base and people that knew that person, and they're suffering, and I understand, but there's other people that are suffering too, but I would say try and do it in a healthy way and get around people that have also experienced that same kind of grief and that same kind of loss. I think what I want people to understand is that the folks that we're dealing with here that are incarcerated, that have addiction issues, are human beings. I think there's a large segment of our society that, is about locking them up, throwing away the key kind of thing. But what I think about is, if this were my loved one, how would I want them to be treated? If this were my loved one, what kind of services would I want them to get while they're incarcerated? I hope people realize that this is not about just offering free stuff all the time to people that are incarcerated. What it is offering education, instilling hope, and providing people with resources so that when they leave, they're in a better position. These folks are getting out at some point, and wouldn't you want somebody to come out whole and not broken, and knowledgeable, and motivated for recovery, and to be a participating member of our community, a taxpayer, a father or a mother to their children. And I think what I would want people to understand is that we're not all, bleeding hearts, but we also are human beings, and we care for our fellow man, and we're providing a service to help make our community and our world a better place. And so it's not just freebies. It's we're guarding our community and protecting the lives of the people that we're serving, because we don't want to see them come back here on something, a higher charge. We don't want to see them in the obituaries. I don't want to see people, in line at one of our shelters or laying on the street homeless. I want to see people healthy and happy. So I would hope people recognize the fact that we're working with human beings, and that's important. And we have an opportunity now, while they're incarcerated, to do different things than what we've done in the past, and hopefully they'll pay off, and we'll have fewer homeless people, fewer people that are addicted, fewer people following up with their behavioral health care, their mental health care. So that's what I would want our community to know, that we stand poised and ready to respond to a pretty serious issue that we have going on in our community.